All right, here we go. Now, I've been looking over this chapter a little bit more, and how do I talk with you about your medications affecting cardiac rhythm? And so I'm going to go with it this way. First off, the first one I think about the most is your um, amiodarone. And actually, that's one of your assignments for adult health too, is to know that backwards and forwards because there's a lot of patients on amiodarone. So keep that in mind. Amiodarone is good for all sorts of dysrhythmias, especially getting that atrial fibrillation under control before we flip them over to an oral amiodarone. We'll do it IV and then we'll do oral then. The other thing that we use quite a bit that you really need to look at is digoxin. Again, here we're giving it for atrial fibrillation as well. So adenosine, of course, and all those others. But man, your amiodarone and your digoxin are huge here. So keep in mind that those are important ones to watch, and we're going to be watching blood pressures and heart rates again. And then look at your, there's a really great piece here that gives your contraindications. That's okay, lidocaine's there too. Remember with lidocaine, you're going to have your CNS effects, so that's safety, safety, safety. But I was getting forward to the interactions with food, and I'm looking to see if there's anything there that's that maybe I would have forgotten. Not so much, but remember that page 291 has the nursing intervention client education for each thing, and they made this a table for a reason. So look at it and look at it from the nursing eyes. As far as amiodarone is toxic, we're going to monitor our patients. We're going to inform them uh, about how it will be managing the dysrhythmia. With digoxin, we need to teach the patient how to take their own pulse. Hold it if their pulse is less than 60. That's huge, as well as the high potassium diet. So keep in mind that those are all important parts of medications for cardiac rhythms. Digoxin, amiodarone, digoxin, amiodarone. So please look at that. So let's go into chapter 24. Anti-lipemic agents. Uh, Basically, we're looking at a few different types. And so as we're looking through here, fibrates, you can appreciate what fibrates are. I want to get to, as we're going down here, I think I might have just skipped it, atorvastatin. Need to know atorvastatin. You need to know it, and atorvastatin is something that has side effects that we need to do good patient teaching on. So make sure that your patient teaching goes around hepatotoxicity, right? We're going to look at those liver function lab tests. Make sure that we have a baseline liver function. The other things that happen is these patients get leg cramps or myopathies, and so we want to make sure that we're monitoring for that telling patient that if they do get leg pains, report those symptoms to the provider. They might have to be removed. Tingling, weakness, um, in the peripheral neuropathy type of things. You know, I've known patients who have been on this drug and they felt miserable. Their whole body ached. And it just didn't make any sense. And it was the myopathies. So this drug is very great for lowering cholesterol, but it's also it's a statin. This statin can be also very icky for your patients. So make sure that they know the side effects that they're trying to avoid, so that they can really look at being able to live a quality of life. Because man, simvastatin sometimes gives a person a non-quality life. So keep that in mind. What's important here, it's also identified that you take this sentence, they're taken with it in the evening. And there's a reason for that. And I'm looking to see, it doesn't have it here, but in the hospital typically you'll see it profiled at 8 o'clock or 10 o'clock at night. And it's because of the way the body stores cholesterol. That's why it's typically taken at night. I always question when it's profiled in the morning. Next one, cholesterol absorption inhibitor. Main thing to think about again is that myopathy. It doesn't have as many side effects as the simvastatin. Now, let me tell you why we give Lipitor or simvastatin. It's cheap. And so it's like the first line to go to. Other things get more expensive for patients to be able to afford. So, but that myopathies are here. Let's move on to bile acid. And so, don't see this quite as much, but primarily whenever you think about bile acids, we're thinking about the vitamin supplements that will go with that as well. Niacin, GI distress, facial flushing is what I think about with that a lot. So make sure that you know the nursing interventions for anti-lipemics, and that was really wonderful to cover that as well. So that's the end of Unit 4. Unit 5 is coming up. We're going to round this up really quick, so stay tuned.